There's nothing better than a good night's sleep. We spend around 1/3 of our lives sleeping, and it's one of our most important biological functions. But if you struggle with insomnia, falling and staying asleep can become a living nightmare. Insomnia typically falls into one of the following three categories: difficulty falling asleep, waking up often during the night and having trouble going back to sleep, or waking up too early in the morning. It's estimated that up to 40% of Australians experience insomnia at some point, with 20% sleeping less than 5.5 hours each night. This presentation investigates primary insomnia, which isn't due to medical problems, medicines or other substances. It's its own distinct disorder. Many life changes can trigger it, including long-lasting emotional stress, travel, or other factors such as work schedules that disrupt your sleep routine. Secondary insomnia, in comparison, is a symptom or side effect of other emotional, neurological, or medical disorders. Insomnia not only affects a person's sleep quality and quantity, but the ensuing fatigue impacts mood, energy levels, concentration, and memory. Over time, ongoing sleep problems can lead to severe physical and cognitive impairment, with studies showing sleeping less than 7 hours overnight can increase the risk of obesity, type 2 diabetes, and heart disease, amongst other things. Research has also shown that insomnia decreases workplace performance and productivity and increases the risk of motor vehicle and workplace accidents. Western medical treatment focuses on counselling, medical intervention, or lifestyle changes. Cognitive behavioural therapy can help overcome dysfunctional sleep behaviour and the anxiety associated with it. Short-acting drugs like benzodiazepines, Z-medicines, or melatonin can help relieve insomnia and re-establish a regular sleep schedule. However, side effects for some of these drugs can be significant, with feelings of drowsiness throughout the day. Establishing healthier sleep hygiene is also essential. Introducing daily exercise, limiting alcohol and caffeine, avoiding screen time before bed, and going to bed at the same time each night all helps to encourage a better night's sleep. Despite these many interventions, restful slumber remains elusive for many, and this is the reason so many people seek out the assistance of acupuncture.
Now, let's look at how acupuncture works on insomnia by following three neurological pathways. Sympathetic nervous system triggers fight or flight response. When a person is in a high level of stress or in danger, their heart rate increases, pupils are dilated, blood pressure goes up, and possibly sweating. These physiological responses cause a person to be constantly awake, interrupting their sleep. According to Lee et al. 2009, in their double-blinded RCT paper, they found that acupuncture on HEART7 and PC6 has a positive effect on insomnia. Acupuncture is thought to stabilize the hyperactivities of our sympathetic system. This was measured by a significantly decreased heart rate. They also found there was a meaningful reduction in insomnia severity index score. These findings further supported by Kang et al.'s study. They demonstrated that auricular acupuncture significantly improved both sleep quality and quantity measured by Pittsburgh Sleep Quality Index. Auricular acupuncture decreases an activation of sympathetic nervous system and elevates parasympathetic activities that triggers rest and digest response.
Stress stimulates the hypothalamus to secrete corticotrophin-releasing hormone. It then triggers the anterior pituitary gland to release adrenocorticotrophic hormone, or ACTH. This activates adrenal glands to secrete cortisol. High levels of cortisol stimulate sympathetic hyperactivity, and this leads to alertness and poor sleep. Current animal studies have shown that electroacupuncture on GV20 and yin tang can significantly suppress the secretion of cortisol and reduce glucocorticoid receptors in the hippocampus. Park et al.'s study further supports this outcome, suggesting that acupuncture on HEART7 effectively reduces not only corticosteroid levels, but also ACTH levels, leading to better sleep. Gamma-aminobutyric acid, or GABA, is the main inhibitory neurotransmitter in the central nervous system. It reduces neuronal excitabilities through binding to GABA-A receptors. Many studies show that people with primary insomnia have approximately 30% lower levels of brain GABA than normal sleepers. Since GABA is an important neuromodulator in inducing sleep, some GABA-based medications are currently being used to treat insomnia, such as benzodiazepine and zolpidem. A recent animal study demonstrated that acupuncture has significantly increased the amount of GABA neurotransmitters, modulating GABA-A receptors in hypothalamic neurons. Multiple acupuncture points were used in this study, including spleen 6, pericardium 6, stomach 36, heart 7, bladder 62 and kidney 6. This positive outcome was supported by further animal studies. For example, Du et al. Showed in their animal study that electroacupuncture on GV20 increased the levels of brain GABA. This high neuronal activity plays a great role in inducing sedative effects. In conclusion, the studies in this presentation have demonstrated the positive effects of acupuncture on insomnia via neurophysiological pathways. However, we must consider the pitfalls of these studies, such as the small sample sizes, controversial sham control devices used, and the extrapolation of results from animal studies to humans. Despite these issues, the positive impact of acupuncture on many diseases, including insomnia, should not be overlooked, and we need to develop larger-scale human randomised control trials with adequate sham control devices for future research.